Hey everybody, this is your girl Martine Myers coming in for another day of 12 days of Vlogmas Fibroids edition. Today we're going to be talking about what do fibroids pain feel like. I'm going to be speaking from my personal experience of 21 years with fibroids, a lot of pain, a lot of agony. So I happen to be one of, I would say, the best people to be able to answer this question for you. So, what do fibroid pains feel like? For me, fibroid pains were like stabbing pains in my pelvic area. The pelvic area is right under the stomach before your private part, I would say. So, yeah, stabbing, nodding, like really nodding, like pulling, kind of like this type, pressure, a lot of pressure, down there by that area. It was quite uncomfortable. Every now and then it would come and go, but there are times when during menstruation, during those times, the pain was heightened. So let's say on a regular, if on a scale of 1 to 10, if the pain was like in between, let's say like a 5, by the time I got to the menstruation cycle, it went to the highest, which was a 10. There are times where it could be in a silent mode, but there are times where it could just be excruciating, stabbing pain with the utmost amount of pressure you could possibly think of, okay? It is quite uncomfortable. It is also uncomfortable during intercourse. So that is something that we got to get used to speaking as women, okay? We have to get used to actually being in tune with our bodies, being in tune with how our bodies function so that we can identify what's good and what's bad with our bodies. And the more familiar we become with the terminologies, the more familiar we become with the signs and symptoms, the more informed we will be to be able to question our physicians, our clinicians about the condition. So this is the reason why that I'm very clear and I try to be as concise as I possibly can with this condition due to the fact that I went through it for 21 years of my life. I'm pretty much informed as to what the ups and downs are and what the in-betweens are. So I want you guys to just be focused and direct and not be embarrassed about what you're feeling. Never be embarrassed to question your doctor in reference to how you're feeling, because how you're feeling is what is going to help the doctor assess you in your condition. They need to get that information from you. So journaling about your symptoms, about the stabbing, the excruciating pain, when does it begin? Does it begin in the morning? Does it begin in the afternoon? Does it begin at night? When are you at your highest point of pain is very important for you to jot down. What does the pain feel like for you to be able to explain to your doctor exactly what it feels like, because based on the information you give them is how they're going to assess you. And that's how clinical assessments are done. You have to be able to speak and you have to be able to share and convey your story, your issues with the clinician in order for them to come with a concrete diagnosis. It happens all over the place in the medical field. Because I'm in healthcare administration, I'm quite familiar with the assessment process. So I want you guys to focus on your bodies. Get in tune with your bodies. Focus on your symptoms, the signs and symptoms. Focus on when you are at your highest point of pain. Journal, jot down every single time that you are at your highest point of pain. Journal and jot down every single time you at your lowest point of pain. Journal when you feel good. Journal when you feel bad. That information is vital information that you would be sharing with your physician. And they need to know the highest points. They need to know where you are, how you're feeling with everything. And it's good to put dates down. If you could put the time down, it also helps as well. But the dates are more essential than the time, to tell you the truth. If you're going to create a journal, to know how you are feeling. And the thing about it is that when you create your journal to jot down how you've been feeling with the signs and symptoms that you've been recognizing, it will help you familiarize yourself with your condition and your body. You will become very confident about you, about what you're going through. You will not be ashamed about pretty much what you're going through, because you will know that whatever it is that you're doing in terms of being focused, jotting down your feelings, the signs and symptoms, and also it's like you are assessing yourself. And then when you go to the physician, pretty much you get the clinical assessment. Okay. So in terms of what does fibroid pain feel like, for the ones who have it severely, like I have, like I did have, it's bad. It's terrible. It's painful. It's uncomfortable. And for those who have fibroids, and where they tell you the fibroids are harmless, they don't bother them, that's a minor condition. They're probably at their very beginning phases, or they're just happen to be lucky, but yeah, that's really how it is. So in my personal case, my fibroids were hurting me. They hurt me throughout my life, caused a lot of different issues in my life. The issues that I dealt with were constipation. I had severe anemia, stabbing and pressure in my pelvic area. My ovulation schedule was totally off. I didn't have a clear, concise schedule as to when I was ovulating, and I didn't have a clear and concise schedule for my menstruation either. So yeah, in a nutshell, it was confusing. It was actually detrimental to my health because I had the lowest blood count you would ever think of. Okay. And with severe anemia, you deal with hair loss, you deal with brittle nails, you deal with pain in the limbs, possibly arthritis. I did have arthritis at one point. So all that was due to the fact that I had a severe condition of the fibroids, and it caused a lot of pain. It caused pain with me personally, which indirectly caused pain in my personal relationships. When it comes to love relationships, caused pain in the way that I'm feeling about myself, my confidence, and stuff like that. So that's what I have for you guys on the third day of 12 days Vlogmas, Fibroids edition. By all means, please remember to purchase Faces of Uterine Fibroids is the book. I'm an award-winning author. Faces of Uterine Fibroids is the channel that we have on YouTube. This is why we have this channel, to continue to inform and educate women on women empowerment, as well as women's health, women problems, and women issues. Thank you all once again for being with me. Like, comment, share, and subscribe. See you on the next Vlogmas. Take care.